EMT Prometric questions and answers. Questions 141 to 160. 141. Which of the following natures of illness is most consistent with a patient with low blood glucose level who is acting bizarre and breathing shallowly? A. Cardiac compromise. B. Altered mental status. C. Behavioral emergency. D. Respiratory emergency. The answer is B. Altered mental status. 142. A 42-year-old man was ejected from his car after it struck a bridge pillar at a high rate of speed. You find him lying approximately 50 feet from the car. After manually stabilizing his head, your next action should be to A. Assess the quality of his breathing. B. Grasp the angles of the jaw and lift. C. Administer high-concentration oxygen. D. Determine the patient's level of consciousness. The answer is B. Grasp the angles of the jaw and lift. 143. Which of the following actions is most important when immobilizing a patient with a suspected spinal injury? A. Immobilize the patient using a vest-style device. B. Secure the patient's head prior to immobilizing the torso. C. Select and apply the appropriate size of extrication collar. D. Assess for range of motion by asking the patient to move the head. The answer is C. Select and apply the appropriate size of extrication collar. 144. During a soccer game, an 18-year-old woman injured her knee. You note that the knee is in the flexed position and is obviously deformed. Your first action should be to A. Assess her distal circulation. B. Straighten the knee to facilitate immobilization. C. Manually stabilize the leg above and below the knee. D. Immobilize the knee in the position in which it was found. The answer is C. Manually stabilize the leg above and below the knee. 145. You have applied a pressure bandage and additional dressings to a large laceration with severe arterial bleeding. The bandages are quickly blood-soaked. You should next A. Elevate the extremity and apply a proximal arterial tourniquet. B. Apply pressure to the pulse point that is most distal to the injury. C. Place additional dressings on the wound until the bleeding stops. D. Remove the bandages and apply pressure at the site of the bleeding. The answer is D. Remove the bandages and apply pressure at the site of the bleeding. 146. Which of the following assessment findings would least suggest cardiac compromise? A. Tachycardia. B. An irregular pulse. C. Palpable pain to the chest. D. Nausea and epigastric pain. The answer is C. Palpable pain to the chest. 147. Management of an unconscious, breathing patient with a significant cardiac history would include all of the following, except A. Analyzing the rhythm with an AED. B. Providing ventilatory support as needed. C. Requesting the presence of an ALS ambulance. D. Obtaining a sample history from the patient's spouse. The answer is A. Analyzing the rhythm with an AED. 148. The wall that separates the left and right sides of the heart is the A. Carina. B. Septum. C. Pericardium. D. Mediastinum. The answer is B. Septum. 149. Prior to administering nitroglycerin to a patient with chest pain, you must A. Complete a detailed physical examination of the patient. B. Contact medical control and obtain proper authorization. C. Make sure that the systolic blood pressure is at least 120 millimeters of mercury. D. Make sure that the nitroglycerin is prescribed to the patient or a family member. The answer is B. Contact medical control and obtain proper authorization. 150. After the delivery of the defibrillation with the AED, the patient has a return of a pulse. You should next A. Provide rapid transport to the hospital. B. Reanalyze the rhythm for confirmation. C. Assess the airway and ventilatory status. D. Remove the AED and apply 100% oxygen. The answer is C. Assess the airway and ventilatory status. 151. Which of the following actions would most likely cause a sudden drop in a patient's blood glucose level? A. Mild exertion after eating a meal. B. Eating a meal after taking insulin. C. Taking too much prescribed insulin. D. Forgetting to take prescribed insulin. The answer is C. Taking too much prescribed insulin. 152. Prior to your arrival at the scene, a near-drowning victim was removed from the water. You should manage the patient's airway appropriately while considering the possibility of A. Spinal injury. B. Hyperthermia. C. Internal bleeding. D. Airway obstruction. The answer is A. Spinal injury. 153. A soft tissue injury that results in a flap of torn skin is referred to as A. An incision. B. An avulsion. C. An abrasion. D. A laceration. The answer is B. An avulsion. 154. Following blunt injury to the anterior trunk, a patient is coughing up bright red blood. You should be most suspicious of A. Intra-abdominal bleeding. B. Gastrointestinal bleeding. C. Bleeding within the lungs. D. Severe myocardial damage. The answer is C. Bleeding within the lungs. 155. The effectiveness of chest compressions are most effectively assessed by A. Listening for a heartbeat with each compression. B. Carefully measuring the depth of each compression. C. Palpating for a carotid pulse with each compression. D. Measuring the systolic blood pressure during compressions. The answer is C. Palpating for a carotid pulse with each compression. 156. The position of comfort for a patient with non-traumatic chest pain most commonly is A. Semi-sitting. B. Lateral recumbent. C. On the side with the head elevated. D. Supine with the legs elevate slightly. The answer is A. Semi-sitting. 156. Which of the following structures is the primary pacemaker, which sets the normal rate for the heart? A. Bundle of His. B. Purkinje fibers. C. Sinoatrial node. D. Atrioventricular node. The answer is C. Sinoatrial node. 157. The middle, muscular layer of the heart is called the A. Epicardium. B. Pericardium. C. Myocardium. D. Endocardium. The answer is C. Myocardium. 158. The safest ambulance driver is one who A. Is physically fit. B. Has a positive attitude. C. Drives with due regard. D. Drives with lights and siren. The answer is C. Drives with due regard. 159. You are called to treat a 25-year-old man who is alert and having difficulty breathing. After making contact with your patient, he extends his arm out to allow you to take his blood pressure. This is an example of A. Actual consent. B. Informed consent. C. Implied consent. D. Formal consent. The answer is A. Actual consent. 160. You are providing care to a male patient at the scene of a shooting. The police are at the scene collecting evidence. Your actions should include A. Limiting your care to the initial assessment. B. Beginning care when the police authorize you to. C. Beginning immediate care as you would with any other patient. D. Providing care to the patient while manipulating the scene minimally. The answer is D. Providing care to the patient while manipulating the scene minimally.